If you're close to booking a vasectomy, watch this before you make that call. Most men who reach out to schedule a vasectomy have already made their decision. Their family is complete or their plan is clear. They're done with the research and they want it scheduled. So when a clinic says there's a consultation first, it can feel like a box to check. Sign a form, pick a date, and move on. At many places, that's exactly what the consultation is. But a practice that has done more than 30,000 vasectomies over more than 20 years doesn't run it that way. Consultation is a focused clinical exam. It's where we assess your anatomy and plan our surgical approach. In some cases, we find something that changes the direction of the entire visit. What happens in that consultation shapes everything that comes after it. When a man calls to book a vasectomy, his goal is to get a date on the calendar. He's made his decision, and he wants to execute it. The consultation can feel like a delay, or at best, an administrative step. Some practices design it that way: a consent form and a procedure date. The patient never has a physician examine him until he's already on the table. That approach treats every vasectomy as the same procedure and the same plan for every patient. Your anatomy, though, is your own, and it's unique. The vas deferens sits at different depths in different men. It's the tube on each side of your body that carries sperm. The tissue around it varies, and how close everything sits to the surface varies too. If you've had prior hernia surgery, a previous vasectomy attempt, any sports injury, an avid bike rider, or even just plain old genetics, all of that can change things. It affects what's accessible and how we need to approach the procedure. Your anxiety level affects how we approach the surgery. It changes how we set the timing and what we do to keep you comfortable. Practice, dedicated exclusively to vasectomies, examines all that before scheduling anything. The plan we build depends on what the exam reveals. When you come in for a consultation, one of our highly trained surgeons will locate the vas deferens on each side and map the anatomy. If the tube sits deeper than usual, we account for that. If there's prior surgical history in the area, we plan around it. The goal on both sides is the same: disturb as little of the surrounding tissue as possible. That is what determines how your recovery goes. For most men, it means going back to work the next day. It means bouncing back faster than expected. We also use the consultation to understand your anxiety level, and we're straightforward about why that matters. Some men walk in relaxed and ready. Others have been dreading this appointment for months or years. Both are completely normal, and we've seen every version. For a man who's highly anxious, we set aside more time. We walk him through each step before it happens and make sure he knows what to expect at every point. Those adjustments don't happen automatically. They happen because we asked. We listened and built the plan around the patient. These decisions get made in the consultation room before you're ever on the table, so we can do everything we can to make sure you have an excellent patient experience. That is the difference that shows up in recovery as well. The practice that makes last-minute decisions when the patient is on the table rather than mapping out a plan beforehand often have patients who experience more discomfort. We perform 30,000 vasectomies across 5 locations. We've seen virtually every kind of anatomy and every level of anxiety. That experience teaches one thing clearly: the plan you build before the procedure plays a big role in the success of the procedure. Men who come to us after a difficult experience elsewhere notice the difference before the procedure even starts. The careful exam is what makes a customized procedure possible. The consultation is also where we catch things that would change the plan before the procedure starts. Some men have anatomical factors that make the standard approach more complex. The position of the testicle varies more than most men realize. In some cases, that means a modified technique or additional time. Some men have prior surgical history, a prior hernia repair, previous vasectomy attempt, sports injuries, history of bike riding. All of this can create scar tissue or change what the doctor can access. In those cases, we discuss a modified approach at the consultation so the patient knows exactly what to expect. None of this is unusual. It comes up regularly. And at a practice that does vasectomies exclusively, we've developed approaches for each of these situations. But we can only use them if we've done the exam. And occasionally, the exam turns up something that has nothing to do with the vasectomy at all. Before a patient walks through our door, our office has already spoken with him by phone. We've not only answered the patient's questions, but also walked him through exactly what to expect throughout the whole process. By the time he sits down with the doctor, he already knows what recovery looks like. He knows what the procedure costs. He knows he'll need a ride to and from the procedure and what to expect on the day of the vasectomy. The administrative details are handled before the clinical consultation. That way, the doctor uses that time to do one thing: examine the patient and figure out the best approach for him. That is our standard. Most other practices prioritize paperwork over spending actual time with the patient. That means the exam gets less time and less attention than it deserves. Our standard is the reason the next story happened the way it did. If there's something you've read online that's still giving you pause about booking, drop it in the comments below. We read every one, and the answer is almost always more direct than what you'll find on a forum. We want to tell you about a patient. We had a 42-year-old come in for a routine vasectomy consultation. No complicated history, nothing unusual about the case on paper. He had done his research, and he wanted his vasectomy scheduled. During the physical exam, I found a suspicious lump on his testicle. When I asked the patient if he was already aware of this, he said, yes, my primary care physician already checked it out and said it was nothing to worry about. When I recommended an ultrasound before proceeding, the patient became frustrated, and he pushed back, reiterating his primary physician already addressed it, is unconcerning. He just wanted this vasectomy on the calendar. At risk of losing him as a patient, I told him the ultrasound should happen first. I didn't like the contour of the testicle and was worried it might be cancerous. I explained that doing a vasectomy might temporarily alter his examination and delay diagnosis that could be life-threatening if not caught quickly. I wanted to do what was safest for him, and seeing my concern gave him pause, and after a lengthy conversation, he had come into our office for a consultation on Monday. Begrudgingly, he scheduled the ultrasound for Tuesday because he wanted vasectomy done as soon as possible. We got a phone call on Thursday. The patient was calling to let us know that the lump had turned out to be cancerous, and that he actually already had surgery yesterday to have the testicle removed. He apologized for pushing back so hard and was deeply grateful and told us that our practice had likely saved his life. We never performed the vasectomy. We think about that case often, and not because it was dramatic. We think about it because of what it represents about every consultation we do. Every man who comes in for a routine vasectomy is someone we examine before we proceed. We don't know in advance which consultation will be the one where something critical is found on exam. Neither does the patient. We're not expecting to find something concerning on your exam, but take the time to do the exam because we don't know what we'll find until we look. That case reflects something we want to be clear about. The best care we gave that patient wasn't a technique or short recovery time. It was the willingness to look closely and carefully before we proceeded. We upheld our standard even when he wanted us to move past it. We uphold it for every patient. Not because we expect to find something, because we can't know what we'll find until we look. When you're deciding where to have your vasectomy, the consultation tells you a lot. It shows you what kind of practice you're choosing. Ask the clinic what actually happens at the consultation. Find out whether a physician examines you. Ask whether the surgical approach gets adjusted based on what the exam finds. And ask what the practice does if the physician finds something unexpected during that exam. What you hear back tells you a lot. A practice doing this right will describe a physical exam. The physician actually finds the tube on each side and assesses what's there. They'll tell you the approach gets adjusted based on what the exam finds, and they'll have an answer for what happens if the doctor finds something unexpected. At a practice that's done this more than 30,000 times, that situation has come up. Pay attention if the answer sounds like, we'll go over everything when you come in. Pay attention if they say, it's just a quick appointment before the procedure. A consultation, described as quick, is almost certainly not a physical exam. It's a consent process, and a consent process doesn't give the doctor the information they need to build the right plan for you. A careful consultation signals the same standard on the table. When a practice treats the consultation as paperwork, it's treating your anatomy as standard, and everyone's anatomy is different. A practice dedicated exclusively to vasectomies has done nothing but vasectomies for more than 20 years across 5 locations. That volume builds something a general urology practice doesn't have. At Vasectomy Clinics Chicago, the entire consultation process is built around what the exam actually needs to accomplish. The consultation is where that experience shows up first. What happens in that room tells you what you'll experience on the table. At the right practice, the consultation is where your vasectomy began. What the doctor finds in that exam shapes both the approach and the surgical technique. In rare cases, it shapes the entire direction of the visit. If you're still wondering whether vasectomy affects testosterone or sex drive, our first video covers that directly. It's called The #1 Vasectomy Myth Men Actually Believe. If that question is still with you, that's the right one to watch next.